Prevention of Gum Disease, a digital education program. Outline of this 30-minute course. Part 1. What is gum disease, and tests to detect gum disease. Part 2. What causes gum disease? Part 3. How to prevent gum disease. Plus, an oral hygiene demonstration on a 3D printed tooth model. The last part is a summary with key messages. Part 1. What is gum disease?
So what are normal gums? We can use a model to show you what normal gums are. So we have a tooth over here, and then we have the jawbone that's represented, and the tooth goes into the jawbone. It's quite firmly held in the bone, not coming out. Then what we have is the gum skin that covers the bone. And this gum skin is pink, firm, and does not bleed. So what is gum disease? Stage 1 is where the gum skin goes from pink and healthy to red and bleeding. However, the bone underneath is still okay. Stage 2 is gum bone loss disease. This is where the bone is lost going from some bone loss to severe bone loss over here. With severe bone loss, teeth can become loose and fall out. You feel no pain as the bone is being lost, and your gums may even look okay. It's only when you get to the severe stage you may have symptoms. Now, why can't you see this bone loss in your mouth? And that's because the gum skin, the red gum skin, is covering the bone that's being destroyed.
E-learning summary. E-learning 1, what are healthy gums? E-learning 2, stage 1 of gum disease, is gum skin disease. E-learning 3, stage 2 of gum disease, is gum bone loss disease. Tests to detect gum disease.
So how do you know if you have gum disease? The first way, the dentist takes x-rays, radiographs, that show where the bone levels are. So if you have a look at this picture of a x-ray radiograph here, if you look at healthy bone levels on an X-ray radiograph, they're normally here at the neck of the tooth. When you've had bone loss, in this example severe bone loss, you can see that the bone level is here near the end of the root tip. Another way your dentist can tell if you have gum disease is to use a BPE probe, which is this. They probe your gums and give you a score of 0 or 1 or 2 or 3 or 4. Now, a BPE gum score of 4 means you have serious bone loss, possibly. A BPE gum score of 3 means you have some bone loss, possibly. A BPE gum score of 0 means you have healthy gums. And a BPE gum score of 1 or 2 means you have gum skin disease, but no bone loss, possibly.
Stages of gum disease. You start with healthy gums. Stage 1 is gum skin disease. If you have red, bleeding gum skin, don't wait until it reaches the next stage of bone loss. If you take action now, you can reverse gum disease and return back to healthy gums. Stage 2 is gum bone loss disease. It starts with some bone loss. This is very common, and it occurs in 50% of the population. Most of the gum bone remains, so all is not lost. Take action now, and you can avoid the next stage of serious bone loss. You can keep your teeth throughout life. Gum disease can progress to severe bone loss. This is rare, and this occurs in 5% of the population. Most bone is lost, so teeth can fall out. This is serious. Remember, once bone is lost, it does not return. Key message: you can help yourself now. Good prevention can stop gum disease. E-learning summary. E-learning 1, radiographs, show bone loss. E-learning 2, BPE gum scores, tell you your stage of gum disease. E-learning 3, stage of gum disease, and what action you can take.